In this presentation, we will be learning about the concept of total pain. The presentation has been prepared by Dr. Ajay Kumar Chaudhary, Vice President of Lucknow, National Association of Palliative Care for Ayush and Integrative Medicine. Pain is unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage, says International Association for the Study of Pain. The concept of total pain was given by Dame Cicely Saunders, defined it as a suffering that encompasses all of a person's physical, psychological, social, spiritual and practical struggles, and all these together make total pain. There is multifactorial nature of pain. There may be pain, there may be suffering. The pain could be neuropathic, somatic or visceral or nociceptive. It may be because of psychological state and traits, due to loss of work, physical disability, fear of death. There may be financial concerns. There may be because of social or family functioning and psychosocial influences, and this all together makes the total pain. Physical pain is due to the disease, other symptoms, fatigue and decline in health. Social pain is due to relation in family, role in social life, work life and financial loss. Psychological pain may be due to depression, anxiety, grief, fear, anger, adjustment to condition, and spiritual pain is due to existential issues, faith in God, religious beliefs and personal value. This all makes total pain. Aspects of total pain may be anxiety, interpersonal interactions and non-acceptance. There may be inadequate pain control and verification if patient is receiving pain medication is required. Assessment for new physical cause of pain is further required. There may be altered metabolic states and medical conditions such as hypocalcemia, hypoglycemia, hypoxia, delirium and sepsis could be there. There may be hormone secreting tumors, pheochromocytoma, ACTH producing tumors and thyroid tumors. There may be anxiety from medications, rapid tapering of prednisone, alcohol withdrawal, akathisia associated with metachlopramide hydrochloride, and pre-existing anxiety could be there due to supportive therapy or medication. In case of interpersonal interaction, the individual has fear of isolation from others, fear of loss of career or job status, fear of substance abuse may be there. In case of interpersonal interactions, there may be marital discord, estrangement from the family, isolation from spouse and children, conflict with co-workers and mounting financial stress. In case of non-acceptance, there may be spiritual issues, personal values of life, what death means for him or her could be there. There may be fear of dying alone. The 3-stage model, a guide to anticipate difficulties with greater sensitivity. The initial stage, the patient faces the threat of death. In the middle stage, a universal depression, that is the patient now knows the disease will cause death, and in the third stage the patient acceptance of imminence of own death is there. So, patient's perception of total pain is physical pain, which may be osteopathic lesion, deep tissue or bone pain tender, anxiety, emotional discomfort, it may be due to angry, and depression of the patient. Interpersonal interactions may be family strains and isolation, and non-acceptance of the caregivers, doubting their faith, sense of hopelessness is another issue. So, American Cancer Society in 1988 has defined total pain as pain and suffering, which may involve neuropathic pain, psychological disturbances, social or familial functioning, financial concerns, fear of death, physical disability, loss of work, psychological state and trace, and somatic or visceral pain. In case of prevalence of cancer pain, for many patients, pain is the first sign of cancer. 30 to 50% of all cancer patients will experience moderate to severe pain. 75 to 95% of patients with advanced stages will experience severe pain, and 45% of cancer patients have inadequate pain control, whereas 25% of the patients will die in pain. Problem of pain in cancer patient. Pain is extremely a major problem in cancer patients. It is most disruptive on quality of life of cancer patients. Pain is one of the most feared aspect in cancer patients. Unrelieved severe pain may be associated with disturbed sleep, reduced appetite, unrepaired concentration, irritability and depression, and 69% of severe cancer pain patient to cause consideration of suicide. The total pain concept thus involves emotional loss of function, coping abilities, financial direct costs, indirect costs, physical due to the disease or its treatment, and spiritual guilt, why me, life closure issues may be there. Evaluation of total pain. Evaluate how pain affects the quality of life of the patient, how it affects the routine or day-to-day life. History of pain and other points to be noted: onset, duration, course, referred pain or is it radiating pain, aggravating and alleviating factors, associated symptoms, response to current and prior treatment, including reasons for discontinuing. Multidimensional evaluation of total pain. When patient reports pain, hurting or suffering, a multidimensional team should be involved in assessment. How much patient knows about his or her disease, how much he or she knows about the prognosis, how he or she understands his pain, what are the beliefs about pain, how much pain interferes in daily routine, what bothers them the most, do they think about dying because of pain, is he or she not satisfied with care or treatment, are there any caregiver issues involved, what are their past experiences of pain. So, the biological factors may be disease severity, nociception, inflammation, brain function, psychological factors, mood effect, catastrophing, stress and coping issues, and social factors such as cultural, environmental, economic and social support. Total pain management is teamwork. and is done by an expert team. Focus on the whole person, body, mind and spirit. Pain relief should be at all levels. Promote quality care, increase the support system. There is opportunity to resolve the unresolved issues. Psycho-socio and spiritual issues are also handled. Understanding that if care is not possible, healing is possible. Creating peace and harmony within oneself and others, and there should be high level of satisfaction. So, we should be addressing physical pain, cultural issues, the holistic approach is needed, caring for the caregiver should be involved, emotional pain needs to be addressed, and there should be spiritual healing. We have to learn to handle emotions, rehabilitation whenever is required, ethical issues should be taken into mind, and assuring stress as well as stress management should be there, followed by bereavement to the family. Thank you.